3 patients with type 1 diabetes are now off of insulin because of a clean immunosuppression drug called tegoprubart. Before I go on, please pause this video and go follow my group Crushing T1 on Facebook. We are well on our way to 10,000 people from all over the world that are affected by type 1 diabetes, and I really want you to be a part of it. This group is where I will bring all of the important updates for type 1 diabetes cure research. Back to tegoprubart. This drug is a CD40 ligand inhibitor that prevents the activation of T cells and B cells that would kill the beta cells that are producing insulin that are put inside someone's body in an islet cell transplant. Over here you can see a T cell and a B cell trying to link up so they can communicate about how they're going to destroy a beta cell and give someone type 1 diabetes. Well, tegoprubart gets in the middle of that and prevents that from happening. Over here you can see a dendritic cell and a T cell trying to do the same thing. Isn't this drug just amazing? Now I want to step aside and talk about another trial that is very pertinent to what we're talking about. Eledon Pharmaceuticals, based out of Irvine, California, they are doing another very big trial regarding kidney transplants. This trial is called the BESTOW trial, and what they're doing is they're taking patients who are receiving a new kidney from a donor, and they are using this new drug, tegoprubart, instead of the traditional crappy drug, tacrolimus. The results of this trial are absolutely mind-blowing, and this deserves a whole separate video of its own, but the patients are achieving GFRs up in the 70 to 90 range. The function of a kidney is measured in its glomerular filtration rate, or GFR, and typically tacrolimus has been used for these transplants, and an average GFR for those patients is around 50. So you can see how the efficacy of these graphs are just through the roof compared to tacrolimus. When someone is given a new kidney or a new liver, or in the case of type 1 diabetes, some new islet cells, it's almost as if this drug that has been used for decades is just making it really hard for these grafts to function as efficiently as they could be. One of the most exciting pieces of data to come out of these 3 patients that have been cured of type 1 diabetes is that the beta cells themselves are producing insulin 4 to 5 times more effectively than cells under tacrolimus. Let's talk about the drug that has been used as the standard of care for organ transplants for the last several decades. So we've got 10 years of data here on patients who receive a new kidney with tacrolimus. You can see right away on the very top there was an acute rejection in the very first quarter year, and then there's acute subclinical and borderline subclinical rejections happening every single year as time goes on. And the calcineurin nephrotoxicity that tacrolimus causes, you can see that building, and by year 8 it's just astronomically high. Tegoprubart does not cause nephrotoxicity or neurotoxicity, or it doesn't lead to hypertension or type 2 diabetes. Let's take a look at a few stats about type 1 diabetes. There's about 2 million Americans living with type 1. About 33% of them are hypoglycemic unaware, regardless of whether or not they use a CGM or not. 12% of those patients experience recurrent severe hypoglycemic events every single year, putting them at higher risk for adverse outcomes. 5 to 8% of type 1 adults experience DKA every year as a result of poor glycemic control. So islet cell transplants are not currently an approved therapy in the United States right now, mostly because of the terrible drug that it has to be given with, tacrolimus. So tegoprubart is going to hopefully unlock the potential of islet cell transplants by improving the islet cell graft survival and reducing the side effects, if not eliminating them completely. In these first 3 patients, we don't know of any significant side effects that the patients have experienced. Here's a quick look at what islet cell transplants have looked like over the last several decades in other countries and in trials here in the United States. This is a simplified diagram, but you've got a donor pancreas that is harvested, And these islet cells are infused through the portal vein that feeds the liver, and those cells then go and engraft into the capillaries of the patient's liver. Of course, the big thing that is being worked on right now is mass-producing stem cell islets so that we don't have to use any donor islets, and that is what Vertex is working on a massive scale right now. This is a good diagram to show just how bad tacrolimus is trashing these new grafts put in people's bodies. Of course, these are monkeys here, and look at the difference in days of how long the grafts survived between tacrolimus and tegoprubart. The difference is just insane. In the monkey trial, tegoprubart was also associated with better metabolic control, as well as healthier animals overall, demonstrated by body weight. I'm sorry, but I'm going to do a part 3 where I show you a video of just how tegoprubart works on a cellular level, and I'm also going to show you the actual clinical data from these first 3 patients. You'll be able to see how their A1Cs just dropped over time and how they are all insulin-free right now.